Today we're diving into anaerobes, the bacteria that thrive where oxygen doesn't. These organisms are major contributors to abscesses, bite wounds, dental disease, GI infections, reproductive infections, and necrotic tissue processes. They're incredibly important clinically, but they're also easy to miss because they're hard to culture and often overshadowed by aerobes that grow more readily. By the end of this session, you'll have a clear understanding of the major anaerobic genera, the diseases they cause, how to recognize anaerobic infections, and how to treat them effectively. Let's get to it. Microbes are bacteria that grow best or only in environments without oxygen. Many are normal flora of the mouth, GI tract, skin folds, and reproductive tract. They're not inherently bad, they become pathogenic when they get into the wrong place or when tissue becomes hypoxic. Most anaerobic infections are polymicrobial, meaning anaerobes work together with aerobes to create a low oxygen environment that favors their growth. Anaerobes are the primary drivers of abscess formation. If you see pus, think anaerobes. They dominate bite wounds, especially cat bites, because the oral cavity is full of anaerobic flora. They're central players in dental disease, periodontal pockets, and deep oral infections. They thrive in necrotic tissue, devitalized wounds, and ischemic areas, and they're major contributors to GI and reproductive infections across species. These are the major anaerobic genera you'll encounter. Gram-negative rods like Bacteroides, Prevotella, Porphyromonas, and Fusobacterium dominate oral and GI flora. Gram-positive rods include Clostridium species, both spore-forming and non-spore-forming. Gram-positive cocci, like Peptostreptococcus, show up in mixed infections. Actinomyces and Propionibacterium are important in chronic draining infections. Dog bite wounds are classic anaerobic infections. Cat bites inject bacteria deep into tissues, creating a perfect anaerobic pocket. Pasteurella grows first, consuming oxygen and lowering redox potential. Anaerobes then flourish, leading to abscess formation within 24 to 48 hours. This is why bite wounds swell so quickly and why drainage is essential. The mouth is one of the most anaerobic environments in the body. Periodontal pockets are dominated by anaerobes like Porphyromonas and Prevotella. Tooth root abscesses almost always involve anaerobes. Chronic gingivitis and stomatitis often have a strong anaerobic component. Mechanical cleaning is essential. Antibiotics alone won't fix these infections. Genera is often polymicrobial. E. coli is the primary pathogen, but anaerobes contribute to toxin production and pus accumulation. Closed surface pyometra creates a sealed anaerobic environment where bacteria proliferate rapidly. This is why pyometra is a surgical emergency. The uterus becomes a giant anaerobic abscess. In cattle, liver abscesses are strongly associated with high-grain diets that cause rumen acidosis. Fusobacterium necrophorum translocates from the rumen to the liver, often with Truparella pyogenes. These abscesses reduce feed efficiency and cause carcass condemnation. Rot is a classic anaerobic infection. Fusobacterium necrophorum is the primary pathogen in cattle. In sheep, Dichelobacter nodosus is also involved. Moist, muddy conditions soften the interdigital skin, allowing anaerobes to invade. Postpartum reproductive infections often involve anaerobes. Retained placenta creates a low oxygen environment perfect for anaerobic growth. Metritis is usually polymicrobial, with anaerobes contributed to foul odor and systemic illness. Pleuropneumonia is a classic mixed infection. Anaerobes contribute to foul odor, gas formation, and rapid tissue destruction. Delayed treatment dramatically worsens prognosis. Drainage and lavage are essential. Horses develop anaerobic infections in deep wounds, sinus infections, and GI complications. Any necrotic tissue becomes a breeding ground for anaerobes. Debridement is critical. Antibiotics alone won't work. Anaerobic infections have a very recognizable pattern. A foul putrid odor is a major clue. Gas in tissues, crepitus, suggest anaerobic metabolism. Necrotic tissue and abscesses almost always involve anaerobes. Mixed infections are the rule, not the exception. Culture is possible, but technically challenging. Samples must be collected and transported without oxygen. PCR panels are increasingly used for wound and respiratory infections. Cytology may show mixed flora, degenerate neutrophils, and intracellular bacteria. Sample handling is everything. Exposure to air kills many anaerobes. Drainage and debridement are the foundation of treatment. Antibiotics alone cannot penetrate necrotic tissue or abscesses. Metronidazole is the gold standard for anaerobes in most species. Clindamycin is excellent for oral anaerobes in small animals. Penicillin works well for many gram-positive anaerobes. Aminoglycosides do not work. They require oxygen to enter bacterial cells. Prevention focuses on reducing opportunities for anaerobes to invade. Good wound care prevents deep necrotic pockets. Oral hygiene reduces dental anaerobic load. Managing mud and moisture prevents foot rot. Preventing rumen acidosis reduces liver abscesses. To wrap up, anaerobes are major contributors to abscesses, bite wounds, dental disease, reproductive infections, and necrotic tissue processes. They're easy to miss, but essential to treat correctly. Drainage and debridement are key, and metronidazole is your go-to drug. Recognizing the clinical patterns will make you much more effective at diagnosing and treating these infections. If you found this video helpful, please like and subscribe. Thanks for joining, and I'll see you next time.